Welcome back, and like Shahzad alluded to, the conversation that we want to develop today happens to be 27th of May, and it is International Emergency Medicine Day. So what exactly International Emergency Medicine Day entails, and how we will talk about how unexpected and unplanned events can occur, accidents can occur, and how it can sort of catapult or burdenize the healthcare system. And when we talk about the emergency medicine, and then we are going to further develop the conversation how particularly in Pakistan we are dealing with these situations, and also the impact of the climate change on the emergency medicines. Because like we alluded to our conversation in our beginning, that how the heat strokes because of the climatic conditions, how people are getting all of this unbridled exposure towards the sunlight, and how the scorching sun can affect your health. And we have seen that I think past in the 2019 there were 1200 deaths because of the intense heat wave, that too in the Karachi. So how are we going to explore the impact of the climate change and how emergency medicines are going to work? And with for that we are very glad that we have been joined by someone who happens to be the expert in this particular field. He belongs to Maroof International Hospital. He has been on our show enlightening us about his profession, about the field of medicine. And without any further ado, we are joined by the consultant in emergency medicine. He happens to be Dr.Mir Abdul Waheed Saab. Assalamu alaikum, Dr. Saab, and thank you so much for coming to our show.
Thank you, Ajra and Shahzad, for having me today
and
here.
Sir, so now let's build this conversation particularly, and we've seen that there is a dire need to observe this particular day, right? So please enlighten our audiences, why do we want to observe this day, and when there is an unplanned sort of an event or accident that happens, or the emergencies happen, how it is interlinked with emergency medicines.
Yeah, all of us always aspire that when we have a problem, we go to the best people.
Yep.
So what about emergency? Would you like that when you have an emergency where your life is at stake, at risk, your limb is at risk, and your eye and sight is at risk, you need to be seen by the people who know what they are doing.
True.
So that's what the emergency medicine deals. In a layman's term, this is the first hour of every disease. Be it an accident, be it a chest pain, be it an abdominal pain, be it any kind of emergency. And the reason for me being here today is to highlight that, like any other specialty, emergency medicine is a specialized field.
True.
And not everyone is trained to deal with emergencies.
Right.
This is a very new specialty in Pakistan. It only started about 5-7 years ago here. But internationally, this is also a very young specialty. In England, say for instance, about 50 years ago, it only started, and now we have our own Royal College of Emergency Medicine, and I happen to be the fellow of the college as well. And
so, which is why, at this point of time, I wanted to ask you this, because I believe that it's of great importance, since we are talking about, the International Emergency Medicine Day. Now, what happens is that, for example, we will see that there's somebody who's a pediatrician, we will see somebody who's an oncologist, so other than emergencies. But with emergency, it can be any problem related to any field, and there's this one individual who's actually responsible to look after you. How does that happen? How does that take place? Because people have been specializing for years and years, and all of a sudden there's this new field, somebody who's an emergency consultant and will look after, may it be the kidneys, may it be the lungs, may it be the liver, may it be the eye, mouth, anywhere. So how does it really work, this specialization itself?
So the answer is that while we train our emergency medicine trainees, they rotate through all the fields of medicine.
True.
So say for airway, you mentioned earlier in the top. So
I'm going to have that debate though, by the way.
So I spent 6 months working in anesthesia department, how to manage the airway. Then I spent about a year in medicine, and I spent another 6 years in surgery, similarly pediatrics, gynae and ops. So in all, the rotation takes about 5 years, and you rotate through all the fields of medicine.
So it takes you almost 10 years to kind of become a specialist.
The pathway is about 7 years
to
be the emergency consultant.
Wow.
Yeah. So that probably answers your question, that we only deal with the life-threatening things in that.
True.
Our job is to stabilize the patient. We don't say that we'll take him to the theatre and operate on him, but we'll say that we'll make it ready and stabilized so that he can be brought to the theatre, and if there is a bleeding going on, that can be controlled.
And Dr. Saab, so now also let's explore, because you talked about that it's a very infant sort of a field, and it's developing not just in Pakistan but also in the developed countries. So now also analyze the impact of the climate change and the climate realities and the impact it does have on the people's health. So government is constantly cautioning us about that how people are going to suffer or might suffer from the heat strokes that are going to happen, right? And that is a very emergency sort of a situation. So when we have a person who is suffering from the heat, number one, how do we identify that this is something, a person who is suffering from the heat stroke, and what sort of precautionary preparedness we need to take, especially as a layman, because this is a situation that is coming from a very personal tone. I mean, we are all facing these heat waves across Pakistan. How do we deal with that?
Yeah, I think this is a very pertinent question in the recent times. The first thing is that awareness about the possibility of having problems facing the heat. So that's, you guys are doing excellent job, and our meteorology departments and NDMS and all those, they are doing their job. So when it comes to diagnosing that, you need to realize that the heat has a pattern of diseases. The very first could be a simple heat rash, that you are exposed to sun and you develop a rash. Then the next is you might get a heat twitch, something like that. Then the next thing comes is the heat exhaustion. This is something at a warning sign. If you cannot pick a heat exhaustion, then it might become a heat stroke. So heat exhaustion is the thing which most of people ignore or don't pick up.
What is exactly that?
So
can you explain?
the symptoms are that you might feel, first you will be exposed to sun, obviously, then you will feel intense thirsty. Then the next thing would be you might have severe headache and you feel like you're going to vomit or nausea. If you don't do anything, don't drink water, don't take yourself off the heat, the next thing would be that you might feel dizzy and then you might actually collapse.
But Dr. Saab, when we talk about the climatic conditions, and particularly when we see, for example, yes, there are people, for example, like me and Shahzad, so we are, alhamdulillah, privileged enough, blessed enough that we can move to the shady areas, or we do not have to work outside. But then there are people living in Pakistan whose job is to work outside. For example, if you see the vendors, the street vendors, or people who...
The labor even.
Yes, the laborers, or even the guards that we were speaking about. So they have to have some sort of exposure from the heat because this is what their job demands, right? So how can those people protect from themselves? And especially the government is constantly cautioning that from 10 to 3, beware of not getting indirect exposure from the sun. But there are jobs that demand direct exposure to the sun. So what are the precautionary measures for them?
I think the first thing is that the times of job or the working hours can be streamlined in that you start early morning and then end by 11, 12 when the heat starts. So that's what's first. But if that cannot be done, then the other thing is that you need to have light clothes where you can breathe the clothes through that, and then you have to cover your head with some kind of shade, which could be a cap, it could be even a chadar hamare log lete hain, and then they can actually soak that in water and keep it on their head just to kind of
avoid the
protect
heat
the heat itself. So, but I think the best thing would be to adjust the working times.
Exactly, and I think everybody needs to do that, because imagine that in GCC countries, ladies and gentlemen, they have a labor union where what they do is that if they know that the temperature is going to go beyond 45 or 44, whatever the limit is, nobody will work, you know, so it's going to be a day off as well, and we certainly need such unions over here who work for the betterment of the laborers too as well. But in addition to that, sir, since we are speaking about International Emergency Medicine Day, I'll come back to where it's more about building awareness. Now what happens is that, you know, for people, a lot of the times, you know, the buzurg of the house or the elderly would be like, God forbid if it's a chest pain, you have something, this medicine, and you know, all of a sudden and go to the emergency. In which conditions do you think people will make it worse for themselves before they even land in the emergency department of any hospital?
Unfortunately, you know, self-medication is kind of a thing which it's, I mean, rampant all over, you see. There is, I think, a joke is that somebody's, if you're in my emergency department, I put is that if you have diagnosed yourself on a Google and you're here for a second opinion, it's better to consult yahoo.com. That's kind of a thing we deal nowadays. But I tell you, it's a very important question that sometimes people, we relate, say, I'll take the example of chest pain. We only relate that if you get a chest pain, that means you might have a heart attack. But in diabetics, they never get chest pain. They actually get atypical symptoms, which could be a pain in the upper abdomen. So they usually take it as indigestion. Majority of the time, the chest pain or the heart attack is considered as an indigestion. So my request today would be that please, if you're a diabetic and if you're getting a pain in the abdomen, please consider that it could be because of the heart.
Exactly.
And there, if you take that indigestion pills and all those things, that actually will worsen the condition, and you will lose that time, because if you are having a heart attack, it's our endeavor, and if you reach a proper emergency department, that your closed heart arteries are opened within 90 minutes.
Okay.
So if you spend time at home, then actually you lose that window, and then the heart muscle becomes difficult to revive.
And I've seen a lot of people do that as well, you know, so they do not feel well. They're like, okay, ma, you know, give me some water, give me some cup of tea. I'm just going to go to bed. And we have seen, unfortunately, that people never woke back up again. You know, yes. So I think it's always best. We always have been recommending, me and Haja, and my team have even actually seen me exercising that as well. You know, you think for a moment that there's something wrong with you, rush to an emergency department. I think that's of utmost importance. But now, sir, let's talk about how we really need to standardize these practices, you know, within the emergency departments. You go to one hospital, the practice will be very different in the emergency department. Sorry, you go to another hospital, it will be different. You go to a public hospital, that will be different. You go to a private hospital, that will be different. Don't you think, as a specialist of the field, that we really need to have standardized practices of emergencies and the SOPs in place, so that wherever we go, we get the same treatment and we save lives?
Shahzad, I think that's what I am here for today. The main thing is that we have very few emergency medicine consultants in Pakistan. I would say out of our own program, which is run by the College of Physician Surgeons of Pakistan, we have only graduated maybe 15 or 20 in the last 3-4 years. And there are almost about 200 now in the pipeline in the next 5 years. So that's not enough.
Okay.
We need look at the number of hospitals you have in the country. So every hospital, unless you have an emergency consultant who knows what to do, then he can only teach the others.
Right.
Until that happens, it's very difficult for anyone to just walk into an emergency department. Unfortunately, what happens is that anyone who's a new doctor, they just appoint him and place him in the emergency department. Whereas, as I alluded to, this is the field which really requires the best of the best
and this
to
is,
be in there.
You know, this is the very first time that I'm actually hearing it from a doctor himself, yes. That, you know, right after the house job, you know, where do you get a placement in an emergency department?
Exactly.
Do you think that's the place where a new doctor needs to be?
Exactly. But if he is there, he needs to be supervised by somebody who is their senior, and they are the ones. So in our hospital, for instance, alhamdulillah, we have the best people in the emergency department.
Maroof International.
And
yes.
I actually, we were discussing offline there, that you alluded to a trauma team concept, which you were talking to. And I can, alhamdulillah, say that we are one of the few hospitals in Pakistan who actually run a trauma team.
Wonderful.
And I am the trauma team lead myself. That means that whenever there is a trauma patient comes in, I start the treatment, and then I get my colleagues from the surgery, from neurosurgery,
right.
from cardiothoracic surgery. We all deal as one team, but we have set principles and guidelines. I'm not going to do it from my own set, I want to do this. No, what is the guideline? And we have guidelines already mentioned and approved guidelines that this is how you treat patients.
So, but in addition to this, Haja, very sorry, because I think it will actually answer a lot of other questions which people might have, and that is that, now for example, if somebody, because I've gone through it myself, unfortunately, my uncle who passed away just very recently as well, Raju. What happened was that he had a stroke. Now when he had a stroke, you know, because as his family members, we would never know what's wrong with him, right? So we would take him to any hospital which is nearby. So that hospital took him in, you know, for a while, and then later on realized that, hey, you know what, this is something else which is beyond our competency, and all of a sudden came back to us running after 2 hours of he being admitted in an emergency department, that, hey, you know what, you need to take him to another emergency. Now, how do you think that, you know, emergency departments really need to realize whether what patients to take in and what patients to not to take in?
Yeah, that also depends on the people then who are running those departments. You know, that unless I know my limitation, one thing in medicine we always say that you need to know your limitation, because our oath says that we do no harm. And if we can't help, we should not deteriorate that. And the first principle is that if something is beyond my competency, I need to straight away say that, no, look, I will make sure that you reach a proper place, and I tell you where to go. But unfortunately, here in Pakistan, that doesn't exist. That's what we are trying to inculcate within our young doctors, and there is a lot of efforts being made by the College of Physician Surgeons of Pakistan. Royal College of Emergency Medicine is has started a very recent program about the foundation building within the emergency department.
Okay.
And Shaheed Zulfikar Ali Bhutto University is taking the lead in that. So we have about 200 trainees at this moment who are being trained in that. So it's all about training the manpower, bringing that
competency
within the field, and also awareness among the general public that when you go to an emergency department, you need to ask, do you have an emergency consultant? And if that's the case, then you feel that you are at the right place. But if not, that's the stroke thing I tell you. The stroke is that if somebody has a weakness on the face, weakness of the arm, having difficulty in speaking, we all know that this is called a fast positive, means face, arm, speech and time. So within 4 hours, we have a time, if we can give them a clot busting drug, that weakness can go away. But it all depends on that. So fortunately, there are about 3 centers in Islamabad where we can do that, and Maroof is one of them. So this is from your program today, we can say that if somebody has these symptoms, please bring them to a proper emergency department where they can get treated.
And Dr. Sir, one last question before we wrap up the segment, and because of the paucity of the time. So we've seen that how antibiotic resistance is cropping up inside Pakistan, and we've WHO actually reported because of the unrestrained use of the antibiotics, there were 60,000 deaths that were reported in 2019. And that also interlinks with one of the very important concepts that you highlighted in your conversation, which is the self-medication that is very common in Pakistan, right? So how can we deal with this pertinent issue of antibiotic resistance that is cropping up, and how can we deal with that unseen enemy that is getting so stronger and stronger in terms of this resistance?
See, this is just the tip of the iceberg which you mentioned about. The problem again comes that the self-medication and then the availability of medications. You walk into any pharmacy and you ask for any antibiotic, you are given that. That's a regulatory problem. It should not happen. The Pakistan Medical Dental Council and the regulatory authorities have clearly said that these antibiotics should not be dispensed without a prescription. But unfortunately, Pakistan में आपको पता है यहाँ पे तल्लक है, जुगाड़ है, हर चीज़ है. आप जाएं, anybody can walk into any department and get any antibiotics. I tell you about our own hospital. We have an antibiotic stewardship program where I cannot write certain medications. Only the ID consultant or the critical care consultant can authorize those. And if I write a certain medication or an antibiotic, my pharmacist has the authority that he will not dispense it. That's what we need to have in the hospitals within. But for general public, I mean, the two sides of it, one, we need to restrain from self-medication, and the other, the regulators have to act, and the pharmacies should not dispense at least the antibiotics without prescription.
Exactly. Thank you so much, Dr. Saab, for being with us. Thank you so much to speak about such an important topic, and we certainly need to have more conversations about it. Thank you so much to Maroof International Hospital. Thank you so much to you too as well for coming down over here and taking out time for all of our viewers who are out there in 46 different countries.